Okay, let's get started. My name is Brandon Baker, and I'm the founder of Home Health Scheduler. Home Health Scheduler is a cloud-based, mobile-friendly care coordination tool for accelerating the intake process for home health agencies. With Home Health Scheduler, you can reduce administrative costs, get insight into your coverage area across disciplines, and ultimately schedule visits in a fraction of the time it takes to coordinate care manually. With respect to reducing administrative costs, we understand that the cost of doing business is always increasing, whether that's regulation or cost containment initiatives. These things impact agencies in a way that gets them thinking about how to cut costs internally and maximize their efforts. Another benefit is to gain deeper insight into your coverage area across disciplines. We have a tool built in that allows you to better visualize where your clinicians are and aren't with respect to your patients. We know that geographic data doesn't always fit nicely into a spreadsheet. But I think the biggest benefit you'll find is that it dramatically reduces the time it takes to get the admission and evaluation visits on the calendar, which reduces the risk of readmission because you freed up time that's normally spent on care coordination to be available for clinicians to treat the patient sooner. And sooner means less chance that the patient is going to be readmitted to an inpatient facility for an infection, complications, that sort of thing. And what you'll find is that your scheduler, whose time was previously used for requesting and assigning visits, is now delegated to this application, which can do it faster, more efficiently, and at a fraction of the cost you would be paying your scheduler to do it. So here's a use case. We've got John Doe. John is a 71-year-old male who's just had a knee replacement. We know he'll need PT, OT, and skilled nursing on his plan of care. So someone on your team, like the liaison, can fill out an order form, and that's going to kick the algorithm into high gear. Let's make the discharge date Tuesday, September 3rd at 3 p.m. I'm going to submit this order, and I should hear a notification in a second. So this is where you really see the benefit here. The algorithm runs to find the most eligible clinician to do the admission visit, then all of the evaluation visits. The algorithm handles all the communication with clinicians and assembles a complete care team with admission and eval visits scheduled according to the Medicare requirements. And all you did was submit a form. That's it. So Lisa Simpson, our example nurse for this simulation, will see this text message. The important part is the link, and since this is a simulation, I've actually routed all the text messages to me for this demonstration. In reality, each clinician is going to get a message specifically for them. So now I'm a clinician, and I get this text message with this link. So I'll click to schedule and pick a visit time block that works in my schedule. So the visit type is pre-assigned based on the combination of disciplines on the order. So you'll see when I click on that link that sent to the nurse that we've got an RN admission here at the top. And that RN admission is limited to scheduling the admission to the morning after discharge. That's the default option. Maybe you give your nurses till the afternoon or the next day. It's customized to meet your requirements. Or maybe you've got requirements for joint patients. The algorithm can handle all those inputs. So let's say this nurse can't treat the patient in that window. They'll either decline it or let their request expire. In either case, another RN will be notified in the same way. So Lisa is going to accept and schedule. So the algorithm executes again, and it follows the pattern here. So clinicians are eligible if they cover the zip code where the patient is being discharged to. And by default, your full-time employees get right of first refusal. Then your part-time employees, then PRN staff, then contractors. And since you'll likely have more than one clinician eligible to treat the patient at this point, we've got a tiebreaker, and that's just based on how close that clinician lives to the patient. So I've got a mock visualization here. And you'll notice that even though this OT here, Eliza Thornberry, who's a part-time employee, even though she's closer by distance, let's say the request is right here, the other OT on the map will get the request since this other OT, Velma Dinkley, is a full-time employee. All the other clinicians in this simulation are full-time employees, and they can all cover zip code 20707, so the tiebreaker will be distance to the patient's home. A good analogy for this feature is a ride-sharing service like Uber or Lyft. When you request a ride, the algorithm selects the closest available driver to your location and finds another one if that driver declines. In the same way, Home Health Scheduler selects the closest clinician so long as they meet the other criteria. So let's go ahead and schedule these visits. And in the interest of time, we'll just say yes to all of them. But first, let's just look at what the clinician will see. We can see that where it comes from, it's coming from Quality Home Health. We can click on the location icon to get a better idea of where the patient is located. This safety feature prevents you from prematurely disclosing protected health information and gives the clinician a better idea of the neighborhood, since zip code areas can be oddly massive or gerrymandered. Let's go ahead and schedule the OT eval. So notice here how, as I schedule also, that the clinician will actually get a live summary of who else is on the case and the time slot that they've been assigned to. So we've got the RN admission. We know Lisa Simpson's coming out on Wednesday morning, and then on Wednesday afternoon, the PT, Fred Flintstone, is coming out. And so now that the visits have been scheduled by the clinicians, the person who filled out the order form will receive an email notification with a summary of the admission evaluation schedule. And from there, the user can send demo data to the clinicians on the order. And there's this nifty little feature here where the reply to addresses are pre-configured with the addresses of the clinicians so that you don't have to go fishing through your contact list for the clinicians assigned to the order. Again, this is a simulation, so all these email addresses here are for demonstration purposes only. So backing up just a little bit to when the clinicians receive a text message. By default, they have 15 minutes to respond before the algorithm re-executes to find another clinician for that discipline. This is adjustable, so if that's too little time or too much time, it can be adjusted to fit your agency's need. The scheduling feature accounts for the Medicare requirements, like the window that admission visits must incur inside of, for example. And when the order is created, the visit type is predetermined. And I alluded to this earlier, but if you've got PT, OT, and speech on the order, that PT would do the admission and the others would do the eval. So just a few notes on security. This application is HIPAA compliant. It's got end-to-end encryption at rest and in transit. So when the data is on the move, it's secure, and when it's being stored in the database, it's also secure. We've configured log drains and audit reports so that in the unlikely case of a breach, we can address it with the tools at our disposal because we have a record of every footstep within the application, usually fingerprints everywhere, and we can track every single one of those, which is an important security feature, especially in healthcare applications. So let's talk a little bit more about features. So therapist or provider management is going to be relatively simple within this application. You can manage their relationship with you, whether that's active or inactive, just by toggling an on and off switch. And I'll show you how that's done. All right, we're going to go to our dashboard right now. And here's the on and off switch I was talking about. So let's toggle on and off this therapist, right? So now they're not credentialed with us. Now they are. And you can add and subtract zip codes from coverage areas when, for example, you don't need a therapist in a particular area, even though they're willing to cover it. So let's say for this speech therapist, we don't need them to cover 20708, even though they've told us they can cover it. So we'll do that. Patients. Patients give you access to the patient information. The only fields you need to create a patient in the system are first name, last name, date of birth, and sex. You can also complete a patient profile if you find it helpful. In addition, you'll see a tabular summary of the orders, requests, and clinicians connected to that patient. So I'll kind of give you an idea here. So here's the requests connected to this patient. If we want to edit a patient profile, we can do so with these fields here. Lastly, we spoke about orders earlier, but just to go over what you would need to create an order, which triggers the sending of these requests to clinicians, is you need to know which disciplines are on the order, the address to where the patient's being discharged to, and then the patient discharge date and time. Last thing before we wrap up is just to touch on what we're working on. So in the future, we'd like to integrate real-time insurance eligibility verification into the platform, so you spend fewer hours on the phone checking insurance. And we're building coverage area maps so that you can better visualize the footprint of your agency. We've even built a little widget so that people can go on your website and check to see if you provide services in their area. Anyways, that's it for this demo. Again, my name is Brandon Baker, and you can reach me at brandon@homehealthscheduler.com, and my cell is listed here on the slide. Thanks for joining me.